It's 2:00 p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and we're bringing you the first briefing of the day from the South Korean health authorities. That'll begin momentarily. Now, from today, South Korea has strengthened its social distancing rules in the capital region near Seoul for a period of 8 days until September 6th. Coffee shop chains are not allowed to let people eat or drink inside. Only takeout and delivery are allowed. Restaurants, bakeries, and bars in the region are not allowed to admit customers between 9 p.m. and 5 a.m. On Sunday, South Korea confirmed 299 new cases of COVID-19. That number has been falling for 3 days in a row since last Thursday, when it was over 400. Of the new cases, 283 are local transmissions, mostly from the greater capital region, comprising Seoul, Gyeonggi-do Province, and Incheon. And as we wait for the briefing to begin, we know that according to estimates based on the official numbers, the number of coronavirus cases around the world has surpassed 25 million, and the number of deaths is approaching 850,000. That's the tally on the website Worldometer, which updates reported numbers around the clock. The number of cases has risen by 5 million, less than 3 weeks since it passed 20 million. The current figure is roughly equivalent to the entire population of Australia. The United States accounts for around 20% of all the cases and deaths. In terms of raw numbers, the U.S. is followed by Brazil. Next is India, which currently has the highest number of new daily cases in the world. Now, when the briefing begins in Seoul, we'll be getting updates on the numbers in Korea as well as the upgraded social distancing measures being taken in Seoul. In the meantime, former Prime Minister and presidential hopeful Lee Nak-yeon has been elected to lead South Korea's ruling Democratic Party for the next 2 years. But because of the growing outbreak in Korea, he had to deliver his acceptance speech on Saturday online in the party's first national convention to be held virtually. It was the latest in a series of events for lawmakers that have had to go virtual. Lee Kyung-eun tells us more.
Because of the pandemic, school, work, and even politics in South Korea have had to move online. The ruling Democratic Party on Saturday live-streamed its new chairmanship election on YouTube, where in a three-way race, former Prime Minister Lee Nak-yeon won over 60% of...
Now we will hear from Director Jung Kyung.
코로나 바이러스 감염증
With
19
regards
국내
to
발생 현황을
COVID-19 and its status in
말씀드리겠습니다.
Korea, I'll
8월
update
30일
you now.
기준으로
As
국내
of
신규
August
발생자는
30th, in Korea, there were
283
283 newly confirmed cases in terms of the community spread, and there were 16 imported cases. In total, the total of confirmed cases comes to 19,699. There were additional 138 people discharged, and until now, 14,903 people have been discharged. And in case of those in critical care, there were 70 people. And fatality rate now stands at 1.64%. And we pay our respect and condolences to those who passed away and to the family members as well. Let me further update you on the newly confirmed cases. With regards to Sarangjil Church in Seongbuk District, 17 people were additionally confirmed. In total, there were 1,035 people confirmed. So there were 590 followers and visitors, and 396 people were additionally traced. And we are actually conducting additional tests as well. With regards to Sarangjil Church, there were 25 locations where we found additional confirmed cases, and 158 people have been confirmed, and we are still conducting epidemiology research. And with regards to August 15th demonstration, we have found 62 additional confirmed cases, and more than 360 people have been confirmed in total. So there were those people who were confirmed due to the participation in the demonstration, and there were also additional tracing that were done as well. With regards to August 15 demonstration, for the additional spread, there were around 10 locations found, and 118 people have been confirmed as a result of that, and we are still conducting tests. And for the Green Hospital in Korea and with the Agape anticipate church-related cases and etc., we found that these cases were connected to the August 15 demonstration as well. And for the Sarang Jeil Church, after having the first confirmed case on August 28th, we have seen 33 additional cases, and in total, there have been 34 cases in total. And according to the epidemiology investigation, after people have participated to the August 15 demonstration, people have again participated in the services in their church, leading to additional infection. With regards to a church in the Yeongdeungpo district, after seeing the confirmed case, we conducted investigation, and as a total, there were 17 people infected in total, and we are still conducting investigation as well. And with regards to the Seoul Sinach Church in the Dongjak district, after conducting an epidemiology investigation, we found 21 additional cases, so there are 22 confirmed cases in total. There were 14 followers, and there were others who were infected as a result of contact with those followers as well. And with regards to a church in the Pyeongtaek city, after seeing a first case, we found additional 8 cases, and we are also conducting investigation on that as well. Let me update you on the overseas cases. As of August 30th, there were 16 people found, and these were 6 people who were found during the community spread, during the quarantine phases, and others found during the community spread as well. And there were also cases coming in from various countries in Asia and Americas as well. With regards to the severely ill and those who are critically ill, until now, there were 323 people who have passed away, and 314 people had other complications such as high blood pressure, so this was more than 90%. And in terms of the age groups, we have found a lot of the death cases to happen with those who are 60 years or older. And as to the infection path, many were related to facilities and hospitals, and those cases actually led to deaths at the percentage of more than 52%. And as of now, there are 70 people who are severely or critically ill. And there are people in the 50s, 40s, and 60s. Once you are infected with COVID-19, people who are 60 or older can actually become critically ill. So for those people, we actually ask you to refrain from going outside. And if you do have to go out inevitably, please make sure to wear a face mask and follow personal hygiene. And if you have any respiratory symptoms such as fever or coughing, even if you are even a little bit unwell, please make sure to visit the screening center so that you can be diagnosed and tested. Recently, in long-term care centers and long-term hospitals and other medical hospitals, we have found cluster outbreaks, and these are areas where elderly people especially go to. So we need to take caution. And in other welfare facilities for the elderly, such as the silver centers, we have seen an increase in the infection, and including long-term care hospitals, we have seen exposures of COVID-19 through hospitals, and we have seen cases where hospitals had to be closed or the medical personnel had to be going into self-quarantine, and this have caused some troubles as well. And based on the epidemiology investigation for the people there are a lot of cases where the spread came through the medical personnel and the spread to the elderly patients. And for long-term care facilities and hospitals where a lot of the elderly people are living in, we ask the medical personnel and the staff members to take a special caution to be very careful. And for cafes and PC rooms where it is very crowded and where it can be multi-use, please make sure to refrain from visiting those. And if you have any respiratory symptoms such as fever or coughing, please don't go to work and please be tested as soon as possible. And even as you're working, please make sure to follow frequent hygiene such as washing hands and wearing face masks. And for supervisors as well, please make sure that you prohibit the entrance of outsiders, and please make sure to sterilize and disinfect the equipment inside, and please also make sure to ventilate the room even if the air conditioner is being operated. And if you have any symptoms, please make sure that you get tested, and you please allow the working personnel to be tested as well. And for the supervisors in the metropolitan area, please make sure to prohibit any visits to the long-term care facilities and hospitals, and please make sure to follow the disease control measures. From midnight of today to August 16th, we're going to follow the strengthened measures for the level 2 social distancing. So we ask our citizens to participate. And especially for those in the metropolitan area, please refrain from going outside. And for visits to, say, franchises or bakeries or restaurants and etc., from 9 p.m. onwards until next morning, you won't be able to eat inside, so you will have to have takeouts or use deliveries. And for areas other than metropolitan areas as well, in those times, some of the restaurants would be refrained from allowing foods to be eaten inside, so please make sure to use takeouts and deliveries. And for sports facilities and etc., you won't be able to be operating until that period. So we ask you to exercise at home instead. And for libraries and study cafes, you won't be able to use those facilities as well. And this also includes the face-to-face courses being held in private institutes. So we ask you to do it in an untapped manner. We are seeing a continuous spread of COVID-19 not only in the metropolitan area, but in other regions across the country as well. So we ask our citizens to practice frequent hygiene and also follow the disease control measures that comes in line with the strengthened measures for social distancing that's being raised to above level 2. So please refrain going outside. And if you do have to go outside, please make sure to face masks. And when you're wearing face masks, please make sure to cover your mouth and nose at the same time. And please make sure to follow the proper method of wearing it. And if you have any fever or other respiratory symptoms, please refrain from going outside and be tested and diagnosed at screening centers nearby. The spread and the speed of the spread of COVID-19 is now slowing down, and it is leading to other cluster outbreaks. For churches, cafes, and other sports facilities, we are seeing the path of infection, and even in medical hospitals and facilities and long-term care facilities that we thought was the last resort, we are seeing cases of COVID-19, and it is a very urgent situation for us. In order to curb the spread of COVID-19, starting today, for 8 days, we're going to implement the strengthened measures for social distancing. We do understand that a lot of people have to take on difficulties and inconveniences, so we want to make sure that we carry out this in a short but a strong manner, because only when we are strong in this, we will be able to curb COVID-19 at a quick amount of time. We have to make sure to take on the difficulty so that we can curb it as soon as possible. COVID-19 is spreading continuously through contacts with people. So if we cut the contact between people, we will be able to cut the connection of spread as well. So although 8 days is not long, we want to ask you to be very strong in adhering to the measures so that you can keep the safety for yourself and those around you. So we ask you to follow the measures and the strengthened measures for social distancing. The way of cutting the connection of path of infection is actually quite easy if you think about it. So we can actually cut it by wearing the face mask in a proper manner and making to practice frequent hygiene such as washing hands. And also we can curb it by not meeting others. And with the administrative orders alone, we cannot curb the virus. So people can actually feel the amount of the crisis when we are facing the crisis, but please make sure to remember the experience that we had in the past and how we had curbed it in the past. So we want to ask our citizens and the government authorities to come together in a concerted effort so that we can contain COVID-19. So we want to ask our citizens to come together as one and wear face masks and refrain from meeting others so that we can curb COVID-19. And we will do our best as well. Thank you.
기자님들이 보내주신 질문에 답변 드리는 시간 갖겠습니다. 먼저 출입 기자.
And that'll conclude our coverage of this briefing. Thank you for watching. The next briefing is scheduled at 4:30 p.m. Korea time. Bye for now.